Hello and welcome. You're listening to the Tasty Tidbits podcast. Get ready to receive rich, well-seasoned, and tasteful tidbits to transform your life. Each week, Dr. Tiffany comes to you with inspirational encouragement and thought-provoking interviews to help revolutionize your walk with God. Are you hungry for more of His presence? Then get ready. And now, your host, author, intuitive life coach, and pastor, Dr. Tiffany Watkins.
Hello, everyone, and welcome again to Tasty Tidbits. I am your host, Dr. Tiffany Watkins, and I'm so excited to have you here on another episode today. And today we're going to talk about something that I think is important, and it's talking about behind closed doors, what families need to know about mental health struggles, addictions, and success. And this has been something that we are constantly dealing with, and it seems like it's increasing even more. And so the more knowledgeable we can be, the more better we can be at helping to support those that are going through addictions. And so I want to talk to you guys and give you a little bit of information about our guest today. And our guest today is Trent Carter, and he is a board-certified addiction specialist and a nurse practitioner with a master's degree from the University of Cincinnati. After witnessing the urgent need for comprehensive addiction treatment in New Mexico, he founded Renewed Health, an innovative recovery center dedicated to saving lives and restoring futures through patient-centered care. Under his leadership, Renew Health was awarded the Best Drug and Alcohol Rehab Center in New Mexico. Trent continues to positively impact his community by expanding access to life-saving treatment and developing new approaches to recovery. So Trent, thank you for being a part of the podcast today. How are you?
I am doing great. Thank you for having me, and thanks for that introduction. Wonderful. I hope I can live up to
it. Yes, and I'm just so excited to have you here today because I know that in society today we are having to deal with a lot of things, and we've been dealing with it for the longest, but it seems like it's becoming more prevalent today, or we may be just being made more aware of what's going on regarding the mental health struggles and addictions, even when in regards to success. So before we get started, I want to just start off and ask you, what are some signs that families and friends should look for that mental health struggles might be leading to substance abuse?
That's a great question. I think first and foremost, you could look for those behavioral changes, right? If they're starting to withdraw from friends, if there's hobbies that they've always been interested in, but now they're losing interest in those hobbies, if they're starting to have frequent mood swings, if they're becoming very irritable, those can be key signs of something that's going on. Then there's the physical signs, right? If they're having sleep disturbances, changes in their appetite, neglecting personal hygiene, and that typically would not have been characteristic for them. If all of a sudden you're starting to see some other coping issues, such as increased use in alcohol, right? Other substances that now they're saying, I'm just trying to take the edge off. Mm-hmm. I think that those are all things that you could look out for. Addiction often creeps in very quietly, right? So just look for these patterns and changes in patterns. And I think that those are going to be your early signs.
Mm-hmm. And, I used to work for Department of Social Service years ago, and I had to, constantly, collaborate with mental health. And a lot of times we dealt with mental health patients and just being able to deal with the issues that they may have with bipolarism or schizophrenia and just depression or, suicidal thoughts and just all of those type of things that they have to deal with. And there are some medications that are prescribed for them, but sometimes it's not enough. And so in what ways can untreated mental health struggles open to the door to drug addiction? Because, sometimes that's just not enough for them.
You're exactly right. So often mental health and addiction they're deeply connected. They can be rooted together. Roughly 50% of people with a substance use disorder also struggle with a co-occurring mental health disorder. Things like anxiety, depression, PTSD, childhood trauma, these can all push someone towards self-medicating themselves. So without treatment, substances can become a short-term solution that can create a long-term problem.
Mm-hmm. And why do you see this to be so, that they're turning more to substance abuse?
they're trying to self-medicate and self-treat these underlying mental health issues. If it is that childhood trauma, if it's severe anxiety or depression, they're looking for something to take that edge off, right? To give them a boost, to help them, if it's numb the pain, whatever their rationale may be. Unfortunately, it's very, very common.
Mm-hmm. Is it more of like opioids, or is it, more of a particular drug than another?
It's all the above, unfortunately. It depends what that individual has going on. So
Mm-hmm.
alcohol is very, very common, and especially because it's oftentimes socially acceptable. You can go get it at, depending on what state you're in, go get it at the gas station.
Mm-hmm.
So
Mm-hmm.
it's easily accessible. The opioids, yeah, for someone who just wants to numb the pain, wants
Mm-hmm.
to get out of it, very common. And another one that I see often too, folks that have untreated ADHD, they'll take
Mm-hmm.
stimulants, so your methamphetamine or cocaine, but the meth is really, really common. And oftentimes they'll come in, I'll do the evaluation, diagnose them with ADHD, get them on the appropriate treatment, and then the meth use just goes away because that's why they were doing it.
Wow. Wow.
Hmm.
That's awesome. That's something new. Um, that we're learning that you will be able to, they do that, to be able to do that. Why do you see that so? Does it just help to calm them, or what does it do?
It does. So the common medications that we use for ADHD here in the States, anyways, is going to be like your Ritalin, your Vyvanse, your Adderall, right? They're all
Mm-hmm.
amphetamines, they're all stimulants, which sounds kind of counterintuitive, right? Like, hey, their mind's
Mm-hmm.
already running fast. And well, in fact, you give them a stimulant and it helps quiet that noise a little bit, helps kind of mute the dialogue, so to speak. And so the methamphetamine is going to do the same thing. I mean, methamphetamine, amphetamine, they're very chemically closely related. And that's exactly what they're doing. They're self-medicating because they say, "Hey, I can finally focus." And of course, I'm getting this boost in energy by using the methamphetamine, but I can
I can
focus, I
focus.
can be productive, I can get things done. Well, if we can just treat you, and I actually don't prescribe Ritalin, Vyvanse, Adderall in my practice. I don't allow it. I don't allow any of my providers to because it is an amphetamine, which
Mm-hmm.
can be abused. It can, become addictive, and that's the exact opposite of what we want for our patients. So there's other medications such as Strattera that we use that is not an amphetamine, does not get abused. You do not get addicted to it, and it's I don't know the exact percentage, but let's call it 85 or 90% as effective as say Adderall. So these people are able to get the benefit that they're seeking without taking something that they're going to abuse.
Mm-hmm. And what percentage do you think it has to do with biological um, versus actual, because some mental health
Environmental
is
influence.
biological, but you know what I'm saying.
Absolutely.
What percentage do you see?
That's a really hard question to answer. I don't have an exact percentage, but absolutely, it's that genetic component, right? And
Mm-hmm.
you've got your
Mm-hmm.
environmental and there's so many factors that can influence this for someone. And yeah, I think that the genetic component can have a massive influence on someone because look, two people might try something for the first time and one person hates it and one person loves it. Why?
Mm-hmm.
Right?
Mm-hmm.
Like myself personally, I've taken hydrocodone one time after a surgery that I had. It was a dental procedure that I had, and I hated it. It was
Yes.
uncomfortable, and I was itchy, and I was like,
Yep.
nope, it ain't worth it. I'll take some Advil next time. Well, why? Why did I react that way as opposed to someone else where they take it and they, get a rush and they say, oh, okay, I kind of like the way that made me feel. Well, there's a genetic component to that, as well as many other things too that could potentially influence it. But yeah, so sorry, long-winded answer. I don't know the percentage, but I can tell
Mm-hmm.
you
Mm-hmm.
without a doubt, it does absolutely have a contributing factor.
That's so good, Trent, because I was thinking about that. Sometimes I watch shows. I actually just watched a show last night about American Greed and about these teens that were in college and, they were selling drugs, opioids, and this type of things, and they were on them. And, and a lot of people, of course, were buying them. And I was thinking to myself, why would they do that? Because when I was in the, hospital and I had to take the medication, I was the same way. It was like paranoid, itchy. I was scratching myself, and I was like, I'd never be on them. But that I'm glad you brought that out. That is could be chemical and biological. That people's bodies react differently, and I never looked at it that way.
Hmm. Yep, it's actually absolutely true.
Hmm.
Again, there's so many factors, right? That childhood trauma, whereas if someone had never experienced that versus someone that did, there's a really good chance that they're going to respond differently. And then you've got all these other environmental factors that influence it. Where do you live? Is it a generational thing? Meaning you grew up watching your parents do this stuff, abuse,
Hmm.
whatever it may be, and they likely grew up watching their parents do it too. It's just generational pass through that's happening. So again, so many influential factors here that could lead someone to go down this path.
Yes, yes. Yeah, and we want to switch gears a little bit because I know that we deal with mental health struggles and addictions, and we see it where we are. But I want to talk about high achieving people, because a lot of times we don't look at it as that, those that may be very successful actually struggle with addictions. They may hide it good, and you'll never know about it. But for those that can kind of see changes that may be happening among those that seem, are successful and are high achieving, what are some red flags or subtle signs that, a high achieving person may be battling with an addiction?
So I want to say this is absolutely true. I've seen it firsthand with my own patients. I mean, we're talking attorneys, other doctors. I mean, I have seen it where they, in fact, have struggled or abused something, or even if it's not to the point of saying that it's a struggle because they're abusing it, but they're using it to maybe give them a edge, a competitive advantage, right? I've
Mm-hmm.
seen it. So, anyways, back to your question, though, some signs that you may see. Well, I don't know, overcompensation, let's say, right? You're finding them pushing harder at work to mask some internal chaos that's going on, could be one. And I think perfectionism, I think for someone that's high achieving, this is going to be very, very common to have perfectionism. And, the thought of if I can keep up appearances, no one will suspect anything.
Mm-hmm.
How about
Mm-hmm.
physical exhaustion, even mental exhaustion? They're starting to withdraw from relationships that maybe previously they hadn't, right? So again, things that are very uncharacteristic for that individual, trying to pick up on these patterns and notice a change that's going on. Um, Even changes in social habits. If again, they're not hanging around their friends or family or going to events that they typically would, if they're becoming a lot more secret, right? Less transparency about what's going on, whereas maybe previously they would voice some of the struggles of professional life or personal life or relationship or whatever it may be. And now they're internalizing a lot of that. They're less vocal about it. These are all, again, patterns and changes that could happen. And I think that it's something that high achievers can struggle with.
Mm-hmm. Mm-hmm. And so do you see a lot more of with alcoholism, opioids, or, what do you, or is it a mixture of it?
All of it. Look, this stuff does not discriminate. It doesn't discriminate. And
Uh,
so this is, I feel like I'm just going to almost repeat myself, but it's comes down to that individual. So it could be, again, okay, so we're talking someone that's high achieving, if you want to call them successful or whatever terminology you want to use here, but maybe they have a really stressful job and they don't cope by going home and hugging the kids and getting some exercise to burn off steam. Instead, they cope by pouring that glass of whiskey, and then that turns into two, three, four, five a single night, right? And
mhm.
it's happening on every single weekday. That could be one version of it. Another version that, again, I've seen because this guy was my patient. He's an attorney, very high achieving, successful, I mean, powerful, if you will, attorney, has done a great job for many clients. Um, Getting Adderall. And I mean, this man, he was again not getting Adderall from me. I don't prescribe Adderall,
Mhm.
but I could argue if he actually had ADHD or not versus, hey man, this stuff gives me energy, it gives me drive, it gives me focus, it gives me motivation. I've now got this advantage over someone, right? I'm a little sharper, my cognitive ability, I'm a little quicker. And so he essentially felt like he found a cheat code that he was using to give him that competitive advantage. So look, it doesn't discriminate. Here's another attorney that is a patient of mine, fentanyl. You wouldn't expect it.
Mm.
She came walking in. So I recently published a book about a month and a half ago, and this story made it into the book. But she came walking in, and I mean, there's no telling the dollar value that she had on with, her Louis Vuitton purse, and she's got the Louis Vuitton shoes on, and just everything, right? It's diamonds. I mean, she was dressed very nice, very fancy, was clearly into that. and successful attorney, and she was abusing fentanyl off the
Mhm.
streets. Can you
Mm.
imagine this? And she
Wow.
was, a female that's with her shoes and her purse alone, we're talking, I don't know, $3 or $4,000 at least. And then
Hmm.
she's going to get fentanyl off the street from her plug, her hookup. It's just people don't want to equate that. It's like, wait a minute,
Yeah.
1 plus 1 ain't equaling 2 here. It doesn't quite add up, but it was happening. And she came walking into my office for help. So
Hmm. Like you said, it doesn't discriminate. And I
yeah,
think that's something that we have to, recognize. And like you said, look for those flags, that we can see, because any change you need to start paying attention to as family members, like you were saying earlier. And when you were saying something earlier about the first attorney, how he felt like he had a competitive edge. So how do you counsel that when they feel like that's what actually gives them this edge? And if you take that away, then now they don't have that competitive edge anymore.
yeah. So for him, it had to be gradual because if we made it a 1 day, like, hey, I've been using this stuff, however many times I'm using it a week, to just nothing at all, it feels like you kind of just fell off a cliff, right? And I
Mm-hmm.
didn't want to do that
Mm-hmm.
to him because then you run the risk of 1 step forward, 2 steps back.
Mm-hmm.
And
Mm-hmm.
so it was a process for him. It was very much the journey. It was the marathon, not the sprint. And that's how we went about it. And he just gradually started cutting down on it from daily to instead now it's okay when I really need it, right? I've got this trial that I'm prepping for and right, I've got a couple days, it's going to be really intense focus here. Okay. All right. So we went from 4, 5, 6 days a week down to 2 or 3 days a week. That's progress. I'm jumping up
Mm-hmm.
and down for that. And then
Yeah.
once we got to where we were comfortable doing that, then we kind of took it a step further. Right now, maybe we can do that, but we lower the dose. So you're still taking it that 2 or 3 days in a very high intensity time for him, and but we're cutting down on the dose. So that's what that would look like. And eventually, we got to where he's not using it at all. We did, in fact, get him over to the Stratera to help completely wean off to where he's that way he didn't go cold turkey, so to speak. We had started to wean down, and he started to then hit that wall of man, I need this stuff. I'm losing that edge, right? And so
Mm.
we switched over to the medication that does not have an amphetamine, which again, it's going to act similarly, but it's not to the level of what Adderall is. Adderall is what he was taking. I don't know if I mentioned that earlier or not. And so he did that for a period of time, and that was very easy for him to wean off of the Strattera. And as far as I know, he's actually not currently a patient of mine anymore. But at that point in time, he was not using anything. We touched base probably maybe 3 months later, and he had not used any in that time frame. So as far as I
It's
know, he's still
awesome.
on. Hmm.
Yes. And and again, I hate to refer to the show, but like I said, I just saw it. But the guy, he finally, as well, got free from the addiction and was moving on with his life. But he said, he still struggles with the thought of doing it, possibly doing it every day, but he doesn't. What gives them the strength to be able to, not go back?
So whenever we're able to change our lives, and I think, and I can even back off where we're not just talking about addiction and substance abuse here. I think it's anything really.
Mm-hmm. Mm-hmm.
Obviously, we're focusing on this for this conversation, but whenever we're able to make a change and these positive effects start to happen, whatever that may be, and I can list countless examples, but they become very valuable to us. And we don't want to lose that. And that becomes our new bedrock, our new foundation. And so whenever we're presented with a testing moment, whether you're stressful, it's a stressful day, or you're fighting with your spouse, or even your spouse is threatening to leave you, or I don't know, you can't make rent and now you're worried about getting evicted and you've got 3 young kids or something, right? Very, very stressful moments. Well, it would be easy to want to relapse or have a lapse and go back to what you had beforehand. We have a new mindset. We can think clearer and know, hey, is this going to help my situation or is it going to potentially harm my situation? And if it
Mm-hmm.
harms my situation, this new foundation that I have of maybe it's a better job, maybe it's a repaired relationship with your brother, maybe it's, anything. Hey, I'm back in school and I've only got 1 semester left. if you then fall back and go back to those old patterns, are you going to lose that relationship with your brother? Are you going to be able to attend these classes that you've worked so hard for and you've only got a semester left? You know that they can hit you with a random drug test at work, and now you run the risk of trying to, walk that fine line of, well, am I going to try to cheat the drug test? Can I cheat the drug test? Am I going to get fired? Then I really can't afford rent, right? So we're in a different mindset, and
Mm-hmm.
we want to keep these things that are valuable. And again, that foundation and bedrock that I referred to just becomes stronger for we don't have to fall as far.
Mm-hmm. That's good, Trent. So why do you think addiction often hides behind success and influence and high achievement?
Ooh, success and achievement. Shame and stigma is one, which again, there is a lot of stigma associated with addicts and even the treatment often that can follow with it, but that
Mm-hmm.
shame. So, I mean, you've got these high achievers, which not always, but oftentimes are successful individuals, right? Or someone that may even be in a spotlight and they fear that judgment. They don't want to lose credibility. Um, Look, another one, if they're a high achiever and if they're doing well in life, they probably have some money and they've got the financial means to be able to afford this stuff, right? They'll have greater
Mm-hmm.
access because they've got a bank account that's got some money in it. Um, I think another one could be kind of piggybacking off of what we talked about earlier, maybe pressure that's put on them to perform. So,
Mm-hmm.
for example, that attorney that I was talking about, right? He is doing this to give him a leg up, to give him the edge so that he can continue to produce and have these positive results, therefore, for his clients. And obviously, he's getting paid, and it's right kind of this nasty cycle. And so, for him, it was maybe a performance pressure. Hmm,
Mm-hmm.
There's a few reasons.
Wow. And what was the turning point for a lot of your clients that decided that they needed help, like your attorneys that you've dealt with? Did they have to have someone to push them and let them know, or did they come to this realization on their own?
Both. Again, all of the
Mhm.
above. I love these questions, and I feel like I'm not answering them directly. I promise
No.
it's not intentional. Um, again, anywhere in between. I've got the folks that come in that rock bottom, right? I'm at rock bottom. I've got nothing else to lose, and I'm tired of it. I want to change. I'm miserable. I've lost my kids. I've lost my home. I had to walk here because I lost my vehicle. Pretty rock bottom, right? So that's a good source of motivation for them. Others, I gave the example earlier of the spouse threatening to leave. I see that all the time where,
Hmm.
hey, if you don't make a change, I'm gone. I'm not sticking
Hmm.
for this
Hmm.
anymore. I've done this for too long with you and I'm not doing it anymore. So that can be a pretty good motivator too. Unfortunately, what I see happen with that one often is the person that is struggling with the abuse, they're coming in because they don't want to lose their spouse, right?
Right, right. Hmm.
And so maybe they do great for a couple of months or a
Hmm.
few months or a year or whatever. And then finally the spouse got off their back, right? They kind of stopped harping on them. Hey, I did enough. I put in some work. You're seeing it. You're happy. You're not harping on me about it. And then they slide right back into those same patterns and habits and routines again. I've seen it now. It's not always, it's not all the time, but I've seen it happen so many times because they didn't truly have that internal motivation. They're doing it for someone else, not themselves.
Hmm. Hmm.
So
And for the ones that came in, Trent, I'm sorry, for the ones that actually just come in on their own without no motivation, what was their mindset to get them to come in?
I love you just used that word and you took it right from me because that's what I was about to say was mindset. It's their
Okay.
mindset. They're
Mhm.
seeing this is starting to get out of hand. So, okay, they don't have someone that's harping on them or something like that, let's say, but they want to make a change because they're seeing it affect all these different areas in their life. Again, it could be career, it could be with your children, it could be spouse, even if it's not to the point where it's detrimental yet, but they're starting to see these changes and they don't like it. They don't like who they are. They don't like how they're acting. They don't like the way that their kids are responding to them because, well, hey, I'm drunk every evening and I'm irritable towards my kids and I raise my voice and obviously it scares my 6-year-old and I've been doing this for 2 years. I don't want to do that anymore. And again, I keep giving these examples, but
Mhm.
maybe if I could take a step back and try to put it in like a bigger realm, it affects so many areas of their life. Even if it's not an individual, let's say they don't have a spouse or they don't have kids, but the drug seeking behaviors,
Mhm.
it can be very expensive to afford these habits, these addictions, and
Mm-hmm.
oftentimes they don't have a job that pays enough to be able to maintain that. And so that's when you start getting a lot of crime that can come with
Mm-hmm.
this.
Mm-hmm.
That individual had never had a history of crime before. They don't even want to do it. But if they don't get a hold of, let's say, that fentanyl that they're used to taking daily, well, they've got a physical dependence now. They're going to go through detox and withdrawal, which is miserable, and they're terrified of it. So then they run down to the Hobby Lobby and they grab a handful of stuff and they put it in their pants and run out the door because now they can sell it and they can get what they need and they get their fix. They're not doing this because they want to. They're doing it because they're terrified of going through detox, and their body has this physical dependence. And at that point, they've lost grips. It's not them choosing to do that. They've lost control. It's out of their hands at that point. So there's another example.
Mm, yes, yes. So, Trent, this has just been a great conversation to be able to kind of understand, what each person deals with individually when they struggle with addiction, like you said, and you talk about alcohol, and a lot of times, even when we were in school and we would teach the students, we would tell them, alcohol is a drug. We want to try to separate it and say, oh, it's not a drug, but alcohol, it is a drug. And so just being able to understand that alcohol is a drug, along with the other pills and different things like that. But for those that are listening, what message of hope would you want to give to the listener who may be struggling on the outside, on the secretly struggling with addictions on the inside, but is successful on the outside? What message of hope would you like to give to them today?
Right off the bat, you're not alone. Look, so many successful and respected people have faced this battle, come through it, and even speak publicly about it. But you are not alone. There's so many resources out there that are safe, that are effective. You don't have to go at it by yourself, and you don't have to be miserable. I know that, like, we just got on talking about detox and withdrawal and how uncomfortable it can be. It is, but it's a lot less uncomfortable if you do it under medical supervision. I promise. I've helped thousands of people through it, and you don't have to be miserable. You just don't. Another one is, look, you're not weak if you ask for help. Honestly, I would say the opposite, that you're a very strong person if you're able to do that, to have the awareness that, hey, something's going on in my life. I don't like it. I want to make a change, but I'm not going to let shame or fear block me from getting that change. I'm not going to hide behind it. I'm going to be strong, and I'm going to go out there and I'm going to find the resources that I need. I'm going to tap on my support system, my loved ones, to make a change so that I can be there for the people that need me.
Mm. That's awesome. That's awesome. I love that because to me, that is, you're strong, because you see a situation that you need help in, and you're strong enough to see that and to get out of that. Because a lot of people, even with abuse, like when in abusive relationships, it takes strength to be able to get out of those relationships. It takes strength to get out of any, like you said earlier, any addiction, any situation that we're dealing with in life. It takes strength. And so, when you recognize your weakness, I believe that is a strength once you do something about it and you decide, hey, I want to make a change and I want to be able to do something different. And so, Trent, thank you so much for being a part of the podcast today. This has been a great conversation. And I'm sure and I know that the listeners have truly been blessed by just listening and being able to kind of understand what's going on behind those that may be struggling with addiction. Because one thing I can say, we all have our struggles. It may not be addiction, so we shouldn't look down on someone who has a drug addiction, because you may have a pornography addiction, or you may have a shopping addiction, but we should not I believe that we should not separate those. One is not bigger than the other. Do you agree with that, Trent?
1,000%. It's part of my mission to try to destigmatize and bring awareness to this. And I think that that's what's going to be necessary to truly make a change for these folks that are struggling. But you said it perfectly. I agree with you entirely.
So thank you for being a part of the podcast today. We are so excited that you were able to come. If the listeners wanted to be able to contact you, what is the best way they can reach you?
Yes, thank you for that. So we're on social media. I'm about to put a TikTok out there. I was told I need to do that, but it's up and coming. But we've got, Facebook and Instagram. It's at I'm Trent Carter. That's the handle there. And same for the website, imtrentcarter.com. So there's tons of useful information on there. I put a blog out. If you are someone that's struggling or a loved one that's struggling and you want to find more information about addiction, all things addiction, right? You can get into as niche of a subject within that realm as you want. I guarantee you we've talked about it or written about it on renewhealth.com. So that's my clinics here in New Mexico is Renew Health. So if you go to renewhealth.com and go to that blog there, there's tons and tons of information. And if you want to follow on the socials, it's Renew Health NM.
Awesome. So listeners, we'll also have his information in the show notes. So you'll be able to go right there and reach him. And if you know someone that's struggling with addiction, you can go to his site and find out more information about it to be able to help you and your loved ones as well. And we wanted to be able to get this out because sometimes it's a difficult subject to even talk about among family members and friends because you don't want to offend, but yet you want to help. And so I know that Trent has tremendous resources that will be able to help you in that area. And so listeners, we are so glad that you tuned in today, and we know that it's been helpful to you. And so until next time, God bless. Bye-bye.
Thank you for listening to Tasty Tidbits. If you're enjoying the show, feel free to subscribe, rate, and share with your friends. To learn more about Dr. Tiffany, check her out on Linktree at dr.tiffanywatkins or visit her website, iridescencebytiffany.com. Until next time, stay blessed.